Let's watch what happens to Senator McConnell during a press conference yesterday. He's talking, and then all of a sudden, he freezes. Now, look at his mouth and look at his eyes. Starting to get some fluttering of his eyes or nystagmus. No one intervenes. They notice something is wrong and they're trying to stop. And then he is escorted off stage. But then this happens. 10 minutes later, he returns back to the stage to answer questions. We do know that he suffered a fall early in March and sustained a rib fracture and what was reportedly a concussion. He was subsequently admitted to an inpatient rehab and was discharged home on March the 25th. So what really happened during that freezing episode? The most concerning thing to me is that he went back on stage within 10 minutes of this event. Any medical professional or anyone around him should recognize this as a concerning sign that he should have went to the emergency room and been evaluated by a physician. What me as a neurosurgeon worries about in someone that's in their 80s and sustains a fall and then has an episode like this weeks after the event is that this could possibly represent a seizure-like episode. It could also be a sign of a stroke or a TIA. Obviously, I am not his physician and I do not know what exactly happened during his initial trauma in March or what his imaging showed at that time. But what we would also be most concerned about is what's called a chronic subdural hematoma. What we worry about, particularly in a fall that was hard enough to cause a broken rib and a concussion, is that a patient's brain can shake around in the head and you can tear bridging veins that bridge between the skull and the brain. You're also at higher risk of that if you take a blood thinner, which unfortunately a lot of people in their 80s are. You can have a small bleed in the subdural space, which can grow over time. Here's an example of what a subdural hematoma looks like that is chronic on a CT scan, but basically you can get a collection of old blood that develops between the skull and the brain, and over time it can expand. That can cause compression of the brain, which can cause altered mental status, seizures, weakness, confusion, and even death if left untreated. And I don't know the specifics of his case, but I do hope that he sought medical attention and that he takes some time off to allow his brain to heal from this injury.